HIV epidemic remains a major concern on the global health agenda, despite the progress made in reducing incidence and improving access to antiretroviral treatments. Zambia is one of 15 countries in the world that have the highest HIV disease burden. It is the leading cause of death among adults aged 15 years and older in Zambia, with estimates of about 20% of adult deaths attributed to HIV. As estimated, 6.6% of young people are HIV positive, and prevalence is higher among young women, 8% than men. It is for this reason CIDES and cipher undertook a study for local dose study which looked at the efficacy of HIV vaccines.
The participants that were enrolled in this study were all HIV uninfected women in sub-Saharan Africa aged between 18 and 35 years of age at risk of HIV infection, and they were tested for HIV every 3 months for the duration of the study. So the study was comparing the standard of care versus the vaccine and standard of care.
Vaccines, we have people that are able to discover new drugs. We have all that. What we are having as a challenge is financing. Financing is the issue that is just having a problem for us. Once we are able to mobilize enough resources, the ideas are there, the expertise are there, the infrastructure is there, for us to be able to discover new drugs, for us to be able to discover new vaccines. We do have all that. So I think that is, and we are actually working towards solving the issue of resources as well.
Speaking during the dissemination workshop in Lusaka, University of Zambia-Biomedical Research Committee Chairperson Dr. Sody Munsaka has expressed disappointment over the outcome of the local dose study, stating that the study was not a success.
Most of the findings is that the study was not successful. So basically what we mean is that the vaccine was not efficacy, or it was not efficacious in preventing HIV infection. So basically the way the study was done is that they recruited people who were HIV negative. They were given the vaccine, so half of them were given the vaccine, the other ones were not given the vaccine. But both groups were told to adhere to HIV prevention protocols, including abstinence, condom use, and so forth.
He has further revealed that the reason why the study was conducted was to make the public aware of the finding results being conducted in the fight against HIV.
Another study will be done to actually assess the efficacy of that study. And the reason why we are doing this is that we want the public to be aware of findings of these results.
Monitoring HIV prevalence patterns and trend is important for efficient planning, resource allocation, and informing programs at the global level. Margaret Chota, Movie TV News in Lusaka.